question. There are about 200 plus issues which can be attributed to obesity. You have metabolic disorders, like you said, diabetes, the metabolism associated liver disease, kidney disease, heart failure, heart attack, so to say.
Welcome to Amplifying the Care, where we bring you conversations that matter for your health and well-being. And my name is Chakshu. Today we are talking about obesity, how it affects the body, the mind, and even society at large. And as we go along, we'll also touch upon the evolving world of treatments, including some of the new medicines that are reshaping the way we look at obesity and diabetes. And with me today, we have Dr. Bipin Sethi, MD, DM, Endocrinology, Care Hospital Center, Banjara Hills, Hyderabad. Doctor, thank you so much for joining us today. And my first question is, obesity is often misunderstood. Could you explain what it really means from a medical perspective?
Well, misunderstood in the sense that most people feel that obese people are themselves responsible for what they have. So they have actually invited that. So obesity is in it by itself is a chronic disease to be reckoned with, which has got multiple inputs for its causations and huge consequences. So we don't any longer hold an obese person responsible for his disease. A smoker can be held responsible for causing lung cancer, but I don't think we are in those days when we should call an obese person as solely responsible for the obesity.
Yeah. Okay. So if you talk about the impacts, so what are the key health consequences of obesity, especially when we talk about conditions like diabetes?
And that's a good question. There are about 200 plus issues which can be attributed to obesity. You have metabolic disorders, like you said, diabetes, the metabolism associated liver disease, kidney disease, heart failure, heart attack, so to say, host of cancers, gestational diabetes mellitus. So it has got many ramifications, which could be classified as metabolic, organ specific. For example, arthritis, urinary incontinence, infertility, irregular cycles. Think of the things, and you have many issues. So I guess excess fat, when it is stored in areas other than the body is supposed to store them, can cause issues starting with liver, pancreas, muscle, heart, and you can have a host of problems. So as I said, there are many disorders, but majorly metabolic disorders, disorders related to the heart, kidney, liver, and also issues of mechanical nature, hernias, joint pains. So you have multiple problems.
Which is the most painful.
Yeah, and it will then lead to a spiraling effect, as in you are overweight, so you had knee pain, and because you had knee pain you couldn't walk and you became overweight. So then you go to the orthopedician, he says, lose weight and come back. He says, how am I going to lose weight?
Okay, so when we talk about obesity since the beginning, when I got to know what is obesity, so there are a lot of myths. Many people think obesity is only about overeating. So can you explain me what is the actual reality behind?
Well, I guess the old thought was that lesser physical activity and more intake of food will cause obesity. In the broadest sense of the term, this actually holds true. That an individual who is overweight, for some reason, by whichever means, restrains the intake of food, they lose weight, whether it is by surgery or by whatever measures you take. But as I said in the beginning, we don't hold the person responsible for that invention, because 40 to 70% of obesity is genetic. You separate two identical twins, lay them in two different places, and they have almost exactly the same weight. If it was only environment, how did twin 1 and twin 2 have identical weights?
Exactly.
So 40 to 70% genetic content is huge. On top of that, there could be altered gut-brain signals, which could be mediated by microbiota. There could be very small chances of having a hormonal issue. There could be an inflammatory state. There could be an issue of inability to control what is called hedonic hunger. I'll just explain to you that. I didn't eat food in the morning, I feel hungry, because my body needs some
Yes, definitely.
nutrients, some energy. I eat my food, and then you get me ice cream, or you get me a nice chocolate. So that is a hedonic hunger. Just for pleasure, I want to eat. So people might eat more unknowingly because of hedonic hunger. Or you may be depressed, and the only thing that you find solace in is food. You may have physical restrictions, as we just discussed about having osteoarthritis. You may be on drugs, antipsychotic drugs, which can make you put on weight. You might be on drugs in diabetes, which can make you put on weight, like insulin, pioglitazone, sulfonylurea. So there can be huge number of reasons why a given individual is overweight. Broadly, a person consuming calories in excess of the requirement day-to-day basis accumulates weight, but it is not always that he overweight, therefore he has become, and we are solely responsible for that. In fact, microbiota have come a big way. It's found that people who take Diet Coke gain more weight compared to those who don't take Diet Coke. There is something that changes the microbiota. Why I talk microbiota? Microbiota are, crudely speaking, those organisms which make you utilize the food in a better way. So if I give you 1,000 calories and you utilize the entire 1,000 calories, you gain weight. But if I take 1,000 calories, I utilize only 700 calories, I can't gain weight, though both of us are eating the same food. So there are people who believe that microbiota might also contribute. So you have the metabolic hunger, hedonic hunger, which we just discussed, and you've got the microbiota associated issues, which can alter the signals, can increase the leakiness of the absorptive substance, can cause low-grade inflammation, and then together cause obesity.
Yeah. You told me that you are 65. What is the secret of your fitness? Because I think you're more fitter than me.
You used to read those topics, the Mandrake, the magician?
Yeah.
Magicians don't tell. So it's about, this question has been asked not by just you alone, there are many other people who ask that question, that people who are lean are not lean by design. They make efforts.
Wow. Doctor is making efforts. Yes. Okay. So if you talk about treatment and lifestyle, when it comes to managing obesity, what are the practical steps someone can take? Upar se.
Yeah. So I think the best thing to do is, if we recognize, first we recognize that there is a problem.
Yes.
And that this is not healthy.
Yeah.
Most people think that it is healthy. If somebody is married and doesn't gain weight, they think that the wife doesn't cook. Or they're having a fight, or they're going to separate. It's not true.
Yes.
So what happens is that if there is first a recognition by the patient that this is not good.
Yeah.
Now we are not defining obesity just by weight. We are defining obesity also by waist circumference. We are defining obesity by the waist to height ratio. We are also defining obesity by metabolic disorders. We are defining obesity by, if somebody has joint pains, then inability to carry the activity that other people carry out at that particular age. If somebody is incontinent, that obesity is relevant, whatever the weight may be. So coming back to what we said, so therefore, first they have to recognize that this is an issue, which can, spiral off into something more serious.
More serious, yes.
Two, anything that they are doing is worthwhile. So when you are, say, doing something for the first time, I want to learn computers. I can't become an expert or Bill Gates in one day. So you can't lose weight in one day. So you have realistic expectations. Put in your efforts and concentrate both on physical activity and diet. Now I'll tell you why. If you take diet alone, you lose weight.
Yeah.
And the weight loss doesn't come from fat, which we actually want to lose. It comes also from the muscle.
Muscles.
And if you are not doing any exercise, the muscles get wasted. So if you are doing an exercise, the muscles are there. At least you don't lose the lean body mass. If you do resistance exercise, take good protein. Plus you have a negative calorie deficit, so you also lose fat. If you are doing only exercise, you don't lose much weight. You and me are sitting, we are spending 1.5 calories per minute. I go for a walk, I lose 4 calories per minute. That means in an hour I lost 240 calories, but I would have lost 90 anyway. So I have lost what? if I was good in mathematics, I would not have been sitting here as a doctor. So you lose something like, say, maybe 160 calories more for 1 hour. And if you take away a little bit of kaju katli, 160 is gone.
It's all gone. Yes.
So diet and this, they are complementary. Diet will actually cause more weight loss. With less, if you can say, less effort or time.
Definitely.
So lifestyle is the cornerstone of every program that we do. Unfortunately, it's not sustainable. Anybody and everybody who wants to lose weight has lost weight. It is the maintenance of the weight loss and sustenance of weight loss which is very, very important and relevant. You know, we have celebrities who lost weight, and you look at them after their marriage or after whatever, they look almost the same, despite 5 trainers, 6 dietitians, 1 year. Because what happens is when you lose weight, you have taken some food, the body has taken an effort to digest it and store it. It's not going to let go so easily.
Yeah.
So you have a tug of war between your desire to lose weight by way of physical activity and diet, and the body's defense mechanisms which actually go up when you are hungry. So these are various hormones which make you feel hungry. So this imbalance of sorts eventually leads to overeating. And what happens at the end? You lost more muscle and less fat, and you are, though the same weight, more fatty than muscular. So this yo-yo dieting is more harmful than not dieting. I'm not saying you should not diet. And mind you, there is nothing like healthy obesity. That if somebody says that I'm not diabetic yet, my blood pressure is okay.
Yeah. It's not like
That's just today. It is not that this is going to be forever. So there is nothing like healthy obesity.
Okay, so doctor, my next question is, in recent years, there's been a lot of buzz around new treatments of obesity and diabetes. Could you tell us a little about these developments?
Yeah, so what happened is that historically, whenever, as I said, whenever you diet, you also have increased appetite.
Yeah.
Because your basal metabolic rate comes down because you lose muscle, so your energy expenditure comes down. So people have been trying from times immemorial to design formulae in terms of diet, like there's something like Atkins diet when you eat only some kind of meat and all that, so which is not the thing to go, because anything that you are not used to, if you are asked to eat only that, your food intake anyway comes in, but how long can you sustain it? So whenever you are on a diet program, your cravings and your appetite increases, and that is the bottleneck of the diet programs. It's not that people who enter diet program didn't want to lose weight or want to regain it. It's just that the body mechanisms are such that they will try to, that empire strikes back. So people have tried to modify the release of what we call amines in the regions of the brain which control appetite. Unfortunately, those drugs were not able to get the results in terms of what is important. Not just weight loss, it's also protection of the heart. This is one of the studies with one drug was prematurely stopped because it caused more heart attacks. So there are many drugs were tried, and only one drug so far has shown that it decreases the major adverse cardiovascular events when it is given to obese people who have had a pre-existing heart problem, and that's a big deal. So in the past you had a drug which caused more MACEs, we call them major adverse cardiovascular events, and now you have a drug which you are given to people who have had an attack but obese, and it decreases those. So there are mechanisms by which these drugs decrease. One of them, not the only one, is weight loss.
Yeah.
There are other things like decreasing inflammation, oxidative stress, etc., etc. But the thing that these drugs do is that they don't make you feel hungry. They attack the area which makes you feel hungry.
जिसको बोलते हैं भूख घटा देते हैं.
हाँ, तो आपका जब आपका भूख ही घट गया तो आप खाएंगे नहीं. और आपने डाइट के प्रोग्राम के लिए आप गए थे उसके अंदर क्यों? You want to lose weight. Because you want to lose weight, you entered a program, and because your appetite is no longer there, then you're not having the cravings. Specifically these drugs, the injectable GLP-1 analogs, the GLP, there are many GLP combinations, GLP antagonists, GLP-1 in oral GLP-1 mimetics, whole sorts of drugs are there. They basically make you feel full, so you cannot eat.
When you will not eat, then
You will lose weight, and there are other mechanisms by which they cause this protection to the heart, etc. But the problem with these drugs is that they also cause some loss of lean body mass,
okay.
which is not as much as the whole body weight loss is, but there is some lean body mass still loss. So you have, some people have typified Ozempic faces, his face becomes all drawn up and all. Anybody who is chubby who loses weight will also lose weight from the face. Plus they have issues of gastric, just the gastrointestinal. You may feel nauseated, bloated, you may vomit, you may have constipation, you may have diarrhea, your gallstones may increase, you may have pancreatitis. These are smaller in incidence, but if you're having 1 million takers, the numerator goes up.
Yeah.
And there is some concern about the ocular side effects, which is being contested. But then if you see in the WhatsApp groups and all, you find that, 2 billion sued against such and such company. So what happens is that you have to look at the numerator. 10 million people have used, and out of that 20 got it. What is the risk-benefit ratio?
Yeah.
So I guess that has to be interpreted. But these drugs are good because they actually decrease the weight and also have other effects on protecting the kidney, protecting the heart, and also protecting the liver also with some drugs. Without the cost that is there right now, I think these drugs are going to be quite useful in future also. You said, I think earlier, that people have tried to give drugs for obesity ahead of diabetes.
Yes.
So it seems to make sense to me. If you treat obesity, then the diabetes will come down. So instead of giving it when somebody is given diabetic, why don't you catch the bus earlier? You decrease obesity, then you decrease whole sorts of disorders. When you treat only diabetes, you have already missed the bus, or you boarded the bus later. So I guess early introduction of these, and there are many Indian companies which are working on these drugs, and I think when the patent goes off, at least for one particular drug, in 2025, from 26 March, and we'll have cheaper versions.
Okay.
And if they have been tested adequately and approved by regulators, I guess people can afford 4,000 to 5,000 rupees per month. Current rate is about 15 to 20 per month. So I guess it will be possible to use these drugs, but we have to use them with caution, that they are not
proper prescription
answer to everything in the world, just like anything else.
Yeah.
There are risks associated with them, and one has to take them forever. I mean, like, there are people who are now coming saying that, can I take it for 2 months or 3 months? Yeah, well, yeah, it will work, but the drug cannot work beyond what
You're
it has been taken for.
Yeah.
So there have been nice, elegant studies which have given drugs to people. One group discontinued, up goes the weight. Other continued, the weight remained static. So the studies were not done for a longer duration. So these people lost weight and they regained about 60% of the weight in say a year's time. So if you follow them long enough, the hopeful people say that probably they may stay there. The other ones who say that they might regain the remaining weight also. So they have to be taken on a long term. So that also the person should know. It's not for, till your wedding photos are clicked or something. You require to take them just like any other drug. We started by saying that obesity is a chronic, multifactorial disease, which is on account of various factors, and this has to be addressed as a disease, not as a course of treatment. So you can't have a course for whatever reason, but many people do it for various reasons.
Yeah. Doctor, my last question is, if you had to share one message with our listeners struggling with obesity, what would it be?
Well, I think obesity is not healthy. There's nothing like healthy obesity. The efforts should come from an individual to see that they maintain the weight to the extent they can, to avoid problems associated with weight, which are not restricted to medical. Psychologically, depression, feeling isolated. So there are many issues that obese people go through. Body shaming, considered inefficient.
That's the most,
So all those things can be avoided but the effects are going to be there if you are A, assuming that this is a disease, B, accepting that it requires treatment. C, understanding that it's a long-term problem. And D, that you require to have personal motivation and participate, whichever program you have.
Yeah.
Lifestyle, medication, whatever.
Whatever it is.
So don't think obesity is going to go away. And the message to our mothers or people who cook is that if there is one obese person in the family, don't have to show affection only by food. You can show affection in some other ways also. So people who are obese or who have family history of obesity, they require the most care.
Yes.
Unfortunately, what happens is that they say that in Hindi, colloquial Hindi, ये तो खेलने खाने की उम्र है. Unfortunately, खेलता कोई नहीं है, खाता ही रहता है. So that's the problem.
Well, thank you so much, Doctor, for joining us today.
Thank
It was
you.
a pleasure meeting you. Thank you so much, Doctor, for this insightful conversation. And to our listeners, remember, obesity is not just about weight. It's about your health. And whether through lifestyle changes, medical guidance, or new therapies, there are many ways forward. This was Amplifying the Care. Until next time, take care and stay well.